Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. If you are just joining us, we are talking about banishing blemishes and ways to prevent pimple popping. Express Care's Dr. Jitka Lom is here giving us advice on how to deal with acne. And during the break, we were kind of talking a little bit about some of the drugs that are out there to treat acne.
Yeah, for sure. So, you know, you start with the over-the-counter medication and how long you should give it, maybe at least 6 weeks, but eventually you're going to need some stronger medication if that doesn't work. So we're talking about medicines. So you can be on oral antibiotics. You can be on topical medicines that are antibiotics and also exfoliating agents such as we use tretinoin or Differin. You might have seen commercials for that one. And we can also we can manipulate the hormones a little bit for women by using either birth control medication or a medicine called spironolactone that works on the hormone levels in the body. So there's all kinds of tools that we have, and each person's different. So one of the most important things I tell patients is this is a long-term process. It's going to take 4 to 6 months to clear your acne, and then there's going to be maintenance after that because that's what it takes.
Okay, so let's go to some of our viewer questions now. We have some interesting ones for this topic. Lonnie from Harmon asks, is it true eating sweets and chocolate can cause breakouts?
It can in some people. If you notice that's the case for you, then stop. But across the board, you cannot say that that's going to cause it for everybody. Okay.
Rhonda from Barragata asked, do exfoliating cleansers work to help clean out blemishes because it seems like it dries my face?
You may be over-cleansing, and that is a problem because you'll actually overproduce oil if you do that. But once a week or so, you can exfoliate. You can use a fine scrub, the finer the better, and just use that to clean your face. And there's also devices that you can use to exfoliate now. Clarisonic has one, Olay has one. It's like a vibrating brush that you use to cleanse your face.
But is that safe to do every day or just once a week?
Not usually every day, once or twice a week, depends on how oily you are.
Okay, Mandy from Jigo asks, what's the best and safest way to get rid of blackheads?
For blackheads, try not to pop them out. If you give them time, and the medication works really well, called tretinoin, that works best. If they're right on the top of your nose, you can use some Scotch tape. Just take a piece of Scotch tape, put it on your nose, and
I've seen the ones where you stick it to your nose, you wet it, and you keep it there, and you peel it off.
Yeah.
I've seen those.
Yeah.
All right, Tasha from Inarahan asks, every time I have school pictures, I always seem to break out with at least one zit. What can I do to get rid of it overnight?
Overnight, well, I think come in for a pimple injection. That would be quickest. But otherwise, you know, make a little slurry, a little paste of baking soda and water, and just make it a thick paste and stick that on overnight. It's like a white paste that will suck out the moisture out of the pimple and help dry it.
Interesting. Okay, Chad from Totu asked, do Proactive and other cleansers really work?
They do, at least at the beginning. They have benzoyl peroxide in them, and they also usually have a little salicylic acid in it, which is a peeling agent, a drying agent. And it works for a time. Most people develop a resistance to those medicines after using them for several months. So you may find that if you're very oily and have a serious acne problem, you'll have to get a prescription.
Okay, and Valerie from Sananya asks, and this is kind of tied in with the other question, does putting toothpaste on my pimple really work?
It can, as a drying agent. Again, it can work for 1 or 2 pimples, but caution advice, because some toothpaste which contains fluoride can actually aggravate your pimples. So if I see women that have a lot of pimples around their mouth, low down here, it's usually from their toothpaste, and if they switch to just using baking soda or a fluoride-free toothpaste, it will help them.
Oh, interesting.
Yeah.
All right, and our last question comes from Sally from PD. Can smoking give me acne?
Again, in some people, smoking constricts your blood vessels and does not allow the same amount of oxygen to go to your face. So for some people, you may get acne from it. For most, not, but it will definitely give you wrinkles and older aging skin. So don't smoke.
All right, and how do you treat acne scars?
Oh, well, we have so many things for acne scars. We can cleanse, if they're superficial, just like on the surface, we can cleanse them with microdermabrasion. We can use laser on them, and we can actually do a resurfacing procedure where using the laser we completely peel off the surface of the skin. For 4 or 5 days the person has a little bit of peeling and crusting, and it all comes off. It looks fantastic. So if they have really deep scars, we may need to do a series, but it's really quite a breakthrough.
All right, yeah. Doc, any last comments that you'd like to leave with our viewers on this topic?
I just want to invite you to the clinic. We have a special going on all week for acne. We're giving out free Cetaphil cleansers and offering chemical peels at a great discount, and we'd love to help you.
All right, sounds good. And you are located at the second floor of the ACNE Shopping Center. And how can people get a hold of you? What's your number?
It's 477-2873.
All right, thanks, Doc, for all of the great advice as usual. Hopefully our viewers can put some of it to use. And of course, if you've got acne issues that you just can't seem to get rid of, always you can stop by the ACNE Shopping Center on the second floor. You'll find Dr. Lom and the Express Care staff to help get you on the right path for clearer skin. In fact, this week, as she mentioned, Doc is having a special for acne, so go and visit them. Dr. Lom will be back again next week when we are going to be talking about TB, that's tuberculosis. Make sure to send us your questions to healthyliving@kuam.com. And of course, if you have a topic that we haven't discussed that you'd like us to bring up on the show, shoot us an email. There's more Healthy Living still to come. Stay with us.